So what are the challenges today in 2023? So just to remind all of you who are still in jet lag or just maybe went into the wrong hole, that we are dealing with MDS. And as we all know, this is a clonal bone marrow stem cell disease characterized by abnormal hematopoiesis. The basis is genetic as well as immune, as well as inflammation. Anemia is the hallmark. Many patients have cytopenia, about half of them. Median age is 74. Incidence increases with age. Patients are usually classified as being either low risk or high risk, and leukemic transformation occurs in 20 to 60%. So this is not new. We are going to say something new today. So what are the challenges as I have listed them? Obviously, one can make another list. First of all, diagnosis. Still based on bone marrow. I'm not saying no, but don't you think that's a little bit old? Don't you think that sometimes we don't catch patients early enough and we might miss the pre-MDS states, and we'll talk about it today, some of the patients having pre-MDS states. We cannot individualize the risk for patients or people who are not sick yet. And we are still doing bone marrow examination. It's okay. It's okay for the doctor, not always for the patient. But you will agree with me that sometimes it's invasive, especially for the elderly people. We are still based on morphology, which is okay, but you may be aware that there is at least 15 to 25% inter-observer differences. And yes, we might think about adding to the morphology, adding to the bone marrow, some kind of new modern tools that are now available, such as genetics, modern genetics, digital tools, and maybe others. We'll talk about some of it today. Now, classifications. Oh yeah, we agree that MDS is quite heterogeneous. Being that heterogeneous, we need classification in order to categorize the patients into groups, in order to know how to foresee the future, how to treat, and so on. And yes, there are classifications. Well, it started in 1982 with the French-American-British classification led by Dr. John Bennett, who promised me that he's going to be online. I hope he is. And then we had the WHO, the WPSS, the IPSS, and the IPSS-R led by Dr. Peter Greenberg. You see him in the picture. And only over the last couple of years, we had IPSS-M, led by Eli Papa Emanuel and Elza Bernard, an international group of experts. And then we had the fifth WHO and the ICC, and I don't talk about the AML classification with the overlapping. So we're having inflation of classifications, and yes, we need some kind of harmonization to make our life as physicians, as well as our patients' life, more easy. Well, obviously, treatment remains a great challenge. Now, if we talk about lower risk MDS, think about it, that we are still using red blood cell transfusions, like 50 years ago. Okay, it's okay. But maybe we should think about additional or better strategies. Erythroid-stimulating agent. It has been with us for about 3 decades. Is it still the first line after transfusions or before transfusions? Or now there is the luspatercept. We might talk about it. Lenalidomide is limited only for del(5q), or maybe we can extend it. And obviously, maybe novel agents are on the way. We have a serious problem with thrombocytopenia. The two agents, the L-thrombopag and romiplostim, the development has been stopped because of the safety concerns. There is an embargo, and we still don't have a good solution for these patients with thrombocytopenia. And what about high risk? Yes, hypomethylating agent is still the first line, but can we somehow overcome the barrier of 50% response rate and 2-year response duration? What can we add? How can we replace? There are some agents on the way, some trials that are encouraging, but they are still many of us still have the feeling that we are kind of stuck. Any novel agents that might be either by themselves or in combination, targeted therapy. What is the role of chemotherapy in 2023, 2024? Still stem cell transplantation, or we might be more modern like our colleagues and think about immunotherapy, CAR-T, and so on? Things are on the way, but still. And obviously, one can make another list and can add, what about the pathogenesis, the biology? We got to have better understanding in the inflammaging, all this area, the role of microenvironment. Genetics, we are now aware that there are many gene mutations, but only recently, and I think Elsa Bernard is going to present a wonderful abstract about the taxonomy. Only now we are starting to understand better the co-mutation, the interactions, and the function. Ion chelation is still a matter of debate, although we know better and we do better. Quality of life, a relatively recent topic that many of us are now aware of. We should try to do our best to improve our patients' quality of life. And yes, not really medicine, but related financial toxicity, it's a real problem that we will have to overcome. And yes, guidelines that will harmonize the treatment are on the way as well under the supervision of the MDS Foundation.